Hi, I'm Donna. I'm the director of the Minnesota Coalition Against Sexual Assault. You might have picked up a theme here. We're all talking about sex. I'm going to talk about violence that uses sex to cause harm. And a lot of, I know that you probably know a lot of what I have prepared to say, and so I won't say it, but there are a huge number, a myriad number of health issues, long-term, short-term health issues that accompany sexual violence, whether it's somebody who's assaulted as a child, whether it's a non-stranger assault, a stranger assault, human trafficking, somebody being used or abused within the sex industry. Those all have a variety of different aspects to them that impact the ongoing health concerns, long-term health concerns of women. And we have, you know, I guess we've heard about we know that sexual violence really targets people who are most vulnerable and who are at risk in terms of being marginalized. That's part of the dynamic of sexual violence, is that those people who are marginalized are the ones who are at greater risk for being assaulted in a number of ways that one can be marginalized. Not every survivor suffers this whole range of negative health impact factors, but a number do, and generally it can often result in somebody not being able to succeed in educational circumstances or career and occupational circumstances, puts them at greater risk for not being able to access or maintain good health care. Specifically around immediate access to health care when one is sexually assaulted. We're doing some good work in Minnesota. We're trying to do some good work in Minnesota. We've got great statutory language that, and we led the nation actually. We preceded VAWA in passing some language that says a survivor should be able to access medical care and forensic examination without cost, regardless of her decision to report or not report the assault. Minnesota led the nation in putting that language into place. VAWA requires it in order for us to receive our several $1 million of Violence Against Women Act money. And while it's in place, in practice, it isn't working. We see so many jurisdictions, because this is handled in Minnesota on a county-by-county basis, and we see many jurisdictions where people are saying, well, I'll pay the bill if you tell me who the victim is. I gotta know there's a real victim connected with this bill. And they don't have to do that, in fact.
Tell me who the perpetrator is.
No, they want to know who the victim is. They don't care. They want to attach my name to this bill so they know that that the bill is legitimate. And so that's only one of the things that happens. But all of the red tape and concerns that can surround that are huge red flags for survivors who, especially in rural areas where stepping into a healthcare facility means maybe my aunt knows that I'm here because I'm a rape victim, maybe my sister does, maybe people that I don't want to know that information. And so what we see happening is that not only do we lose potentially good evidence, but we also lose the opportunity to intervene immediately when that intervention and that care is critical to better health outcomes for a rape survivor. So that's a problem. We also know that in the issues around adolescents, they're incredibly at risk for sexual violence, and there are barriers to accessing services very often that will guarantee them confidentiality. We have some confidentiality language in Minnesota statute, but adults working with youth often really think that they have it is their duty and their responsibility to break confidentiality because they think that's in the better interest of the youth. That information gets out and youth aren't able to access the resources that we need to have them in. So, given all of this, we need health care that's confidential. We need medical records that remain private when somebody is talking about and there is documentation of domestic and sexual violence, because that can create, and many institutions are moving to electronic record keeping, but that creates increased levels of danger, often for victims. We need prevention. I don't know how, we need to have wellness be understood as an absence of sexual and domestic violence. We're talking about wellness. And so primary prevention needs to be happening. That needs to be perhaps incentivized. I would love to see it incentivized, much like non-smoking is, or physical, having costs for health club memberships reduced, because they're that related to health insurance costs. So We need leadership. This is an issue that remains incredibly silent and hidden. It is a public health. We are looking at it as a public health issue. Victims don't report sexual assault because of the shame attached to it and the fear of blame attached to it. We need leadership on this. We need people to be able to say the words, and we need to break the silence about it. So we are looking to do that.